Michael, thanks for coming on the podcast today and coming on to talk about everything you do with Nashville Sports Club. I wanted to first start off by congratulating you guys on making it to the playoffs this year. I know you guys got one final game coming up, but you guys are third in Eastern Conference, correct?
Yeah, we are third based on how the MLS does tiebreakers. Anywhere else in the world, we'd be second, but MLS, we're third.
Just a couple extra tiebreakers there.
Yep.
Well, before we go into the nuanced stuff about your career and how you got involved with soccer and physical therapy, I have to know, how did you become a Man United fan?
It started youth soccer, I would say probably around the time I was in middle school. It was the end of the season, and the coach was giving out like end of the season awards, and his take on it was to give us all like a little figurine of kind of like a player that he felt like we were similar to, and he gave me a Ryan Giggs figurine, and obviously that piqued my interest, and I started following Giggsy, and of course Manchester United. Obviously it helped that they were very good at the time and I was young and impressionable. So yeah, it's just kind of who I've followed throughout the time since then, and I've been fortunate to make it to a couple games and experience Old Trafford. So they definitely have me hooked.
Oh, that's definitely a goal of mine to get out there. I've been wanting to go to a derby match ever since I've started following, and I'm a City fan, so that's why I bring up this topic of conversation. Because prior to the podcast, we were kind of going a little bit back and forth with the banter, but and recently they just had a game, so it kind of makes it interesting.
Yeah, I don't have too many bragging rights these days.
Well, you guys got Ronaldo now, so at least there's some hope there.
Yeah, he seems ageless. It's amazing what he's been able to do. Hopefully the rest of the team can start to perform similar to him.
Hopefully. Well, you started describing your story, I guess, with soccer. Was that when your relationship with soccer began?
Yeah, my guess is that my upbringing was similar to a lot of kids, and that your parents throw you into a bunch of different sports, and something kind of sticks. For me, to be honest, they had me try other stuff, and I just had zero interest. I think soccer from day one, I was probably 5, 6 years old when they first enrolled me, was just always my favorite. I think what I enjoyed about it is that you're always moving. Even if you don't have the ball, you're always moving. And they had me do gymnastics, karate, I think basketball, baseball, and soccer was just kind of constant motion. And so I think at that age, that was what I really enjoyed. And I've just been very fortunate that kind of, growing up and now into my career, that I've been able to stay connected to the game.
And did that love kind of stick with you as you're going through PT school? Was that kind of the motivation as you got into physical therapy school?
It's funny. Going into PT school, I knew I wanted to work in sports, but if you had asked me if, there was a such thing as a soccer PT, I would have said no. I don't think that I really started to, realize that that was a possibility until I've been fortunate enough to go over to the Isokinetic football medicine conference that's in Europe annually a few times, and just being surrounded by physios, from all the big clubs, the European teams, just seeing that was a career path over there, and then kind of through a little bit of networking there, starting to realize that there were some teams within MLS that actually had a PT. And that number, continues to grow. And so I would say that I didn't go into PT school with the goal of, working with a professional soccer team one day. It's just kind of been something that has happened intrinsically as I've continued to kind of go down the path of being able to tie, my graduate degree into, the really, my favorite sport, being soccer. So yeah, it's long story short, going into school, I had no clue.
Well, though, for those listening that maybe not be familiar, when you go to PT school, you don't necessarily have to major or like specialize in anything. You can become a generalist, or after physical therapy school, you can go on and do a residency and kind of specialize in something that you're particularly interested, whether that's geriatrics, sports, women's health, and more. And there becomes more and more residencies moving forward, similar to that of like medicine, but there's been a growing area of interest in physical therapists becoming more specialized in certain areas.
Absolutely. And so, during school, I think that you're starting to see more specialization within school. Like I know that a couple of schools have changed their curriculums to actually allow students to start to go down a specialty path. But if you're talking specific sports, that's usually something that doesn't really happen until you start your career.
Right. And then just same thing with like medicine, right? Like you go into orthopedics and then, that's a specialty. And then you can do a subspecialty of like just doing hip replacements or just knee replacements. And so it's cool to see the profession kind of advancing in that way where you're seeing similarities with medicine and other very stable career paths. You've been in sports, specifically soccer, for so long. I guess, have you seen a growing interest in the sport of professional soccer since you started to now?
Yeah, I think that if you go all the way back to the two instances when the U.S. has been able to host the World Cup, both on the men's side and the women's side. So I think having that event here in the U.S. just created a groundswell of support, and the game has continued to grow since then. I remember way back in 1996. Hopefully, I said the year right, when MLS just had started. There weren't many teams. To see the way the league has grown has been incredible. To see the way that youth soccer around the country has grown has been incredible. To see, the NWSL grow is great on the women's side, and obviously the women at the national level have had a little bit more success than the men, but they continue to maintain that. And then the men's side, I think, is a very young team right now. You see that we have probably more prominent players playing, for some of the larger clubs in the world than we ever have at any point before. And, I think they're full of potential, and I'm really excited to see, what they're able to put together. Big game tonight against Mexico. But they're in a good position within CONCACAF for qualifying, and hopefully they can make it to the World Cup next year and continue to grow as a group.
I'm certainly excited to see the day that men's national teams in the round of 16 or the final 8 or 4, because that's going to be, I think it's going to be electric. I think it'll be bringing a lot of newcomers or new fans once you can see the men's national team on a big stage. I think a lot of people did the same thing around the women's national team, but when you can have both at the same stage, it makes it a lot bigger. I feel like you get more people involved.
Absolutely. Yeah, absolutely. I think now that there is more interest in it, around the country, I think success only serves to grow that and cultivate it. So fingers crossed they finish the job.
For sure. And have you seen a change in the talent at all? Have you seen like more and more people coming up where you're like, this guy's different, like just from the way they play, the way they maybe conduct themselves? Are you seeing any change in the talent as well?
Yeah, I think if you were to just kind of look at America as a whole, it's such a melting pot. And obviously we're one of the most populous countries in the world. And you combine all of that together, and there is just a tremendous number of athletes within the United States. And I think that with increased interest in soccer, you're starting to see some of them choose, soccer over football or baseball or basketball. And again, when cultivated in the right manner, you start to see that kind of feed into some of the players that we're seeing excel today. To some degree, you've got to be a good athlete to get your foot in the door. That's usually kind of at the younger age when you catch scouts' eyes is, do you have that skill set? And it only grows from there. So yeah, I think, it kind of goes back to the last question where we talked about how our current, men's national team player pool is very young, but playing at some of the big clubs. And I think that's going to continue. I think these guys will become our seasoned vets, and there'll be a whole new wave that comes in with just as much promise as if not more than the group we have now.
Certainly. And you develop a lot of close relationship with the guys being the physical therapist. And I suppose I feel some of the injuries associated with soccer are often not really, they kind of throw people for a loop sometimes because they're like concussion, outside of like knee injuries, I guess. And so I wanted to kind of hear from you, like, what are some of the most common injuries you're seeing with soccer players?
Yeah, so this is one of the questions that I've been thinking about a little bit. I'm going to give you a very broad answer to start with. And, I think it depends on the group you're working with. So I've been fortunate enough to work, from the youth kind of grassroots level all the way up to, the best athletes in the country. And just the, different levels of play, the different ages, you're going to see different injuries, which is normal, I think, for any sport. So, I guess to answer specifically where I'm at now, I think that if I compare what I'm doing now to what I was doing in the clinic, I see a lot more soft tissue injuries. If you kind of look around the league in MLS, just like any sport, you see your fair share of the bigger stuff that's surgical and keeps you out, the ACLs, some of the groin and hip stuff. But I think, just in general, for the kind of level that I'm at now, you see a little bit more soft tissue injuries than you do in like a regular PT clinic. And I think part of that is just the way the healthcare system works. By the time you get in to see a doctor and get it diagnosed and see a PT, I think, unfortunately, a lot of the times the issue is somewhat resolved itself. And, at the recreational level, you're kind of able to more or less work your way back into returning to play. But, here it's like it happens and boom, or rehab starts then and there.
Yeah. And did your skills have to change at all from when you were working with different age groups to like now at the professional level?
I would say in a lot of ways, yes. I think one skill that I'm starting to appreciate more is just the ability to work with people and kind of figure out what motivates them, what gets them going. In kind of your normal like sports clinic setting, you're not going to see people but so frequently normally. Again, I know there are anomalies out there, it's done different ways, but just in general, you're not going to see them super frequently. Whereas the setting I'm in now, I see these guys pretty much every day. And so, I've got to really get to know them and figure out how to keep them motivated and keep things fresh for them. So I think that is a very big skill. And then just, adapting to your environment. Just by the nature of it, I have access to more resources here, more time here, a smaller patient population than what you would have in like an outpatient setting. And I think because of the environment, you do develop, a little bit of a different skill set. You hone specific ones, and, maybe something like being able to juggle a ton of patients at once, doesn't become as, relevant in a setting like this.
Was that something that you really had to work on and self-reflect to be like, okay, this is something that's important and valuable. And if I don't do this, it's not only not going to help me, but it's not going to help the players.
Yes, I think that, I can't say again, it's very individualized, but a lot of these guys have done some sort of rehab before, and they've, worked with other high quality clinicians, and they're able to tell if you're, kind of on top of your game or not. So, you definitely got to stay on your toes. Again, it kind of goes back to keeping them engaged. And I think that kind of the point I had reached as a clinician prior to being here was like, I knew that there was like a step beyond like the relationship that I had with a lot of my patients. And part of that was just, having the time, the more frequent interactions, having some different resources, primarily from like a technology standpoint. And having an interest in that, reading the literature, being studied up on it, but not necessarily being able to, apply it in a clinic setting. And then, being here, it was, kind of like I had the interest and, I knew about it, but this was kind of the first opportunity to really be able to apply it, in we'll call it a clinic setting, but the practical side of it.
And, to go back to injuries, I guess, are a lot of these injuries more chronic? Are they acute? Are they things that resolve on their own? I mean, the season's so long. Do you see more injuries so that they're acute or chronic?
The ones that I'm working more with at the moment are more of the acute ones. So, the ones that actually keep someone out from, training or matches, those are the ones that, kind of get most of my attention. For the stuff that lingers, we do try to address that. And, we try to check in on it weekly. There's not as much direct oversight, over that. I wouldn't call it necessarily a home exercise program, but, we'll give guys a program to kind of work through. We'll show them how to do it. There's kind of different themes for different days. And our expectation is that gets carried out on a daily basis. And, the checking in on them to make sure that it's going well, tweaking things where they need to be tweaked. That's more of kind of what our approach has been to more of the chronic stuff. Because, these guys are motivated to play. They want to be on the field. And if it's something that they can play through, then they're more likely to play through it, deal with the pain or discomfort or whatever you want to call it. And as long as we feel like it's something that isn't going to, potentially lead to some sort of disastrous outcome, we make a educated, informed decision, and obviously, make sure the athlete's on board, and will, continue to kind of let them see that process out.
Yeah, because I know in soccer, I mean, me playing myself, I'm sure you are aware, is just like you have your knees bothering you, but like I can just run it off or continue playing, and then like maybe it hurts later, but then like as you start playing, it doesn't bother you anymore. And so I guess, do you have a lot of athletes who are they serious about their home exercise program, or you got to really bug them to try to stick to it?
Honestly, it comes down to the individual.
Okay.
It depends on the personality, and that kind of goes back to what we were talking about before. We're just, in this environment, learning how to, like, who you're working with, getting to know them. I hate to say it, but like what buttons to push, to kind of get the outcome that you're looking for, it becomes even more important.
Of course, yeah. And is there a period of like where you have to educate them? Maybe you're educating them on what's going on with their body, because I mean, these athletes are so in tune with what they're doing and their own bodies and how they feel and all that. And do you spend a lot of time with education with the athletes for injuries?
I would say some more than others. So some are, hypersensitive. Sensitive is maybe not the right word. Hyper aware of kind of what they feel, and they're very in tune with that, and they want us to try to talk through it and explain it. Others are more along the lines of just tell me what to do. Like, yeah, great. Like, I get it, but just tell me what I need to do to make it better. So again, it does kind of come back to the individual a little bit. I think for me, my approach to it is I'm always going to educate them on what's going on. If it goes in one ear and out the other, that's fine. But I've done it. I've done my due diligence. And then there are some that you've really got to know your stuff and be on your toes. Because again, these guys are smart. They've had issues before. They know what questions to ask. Some of them know a little bit about the sports medicine side of things. And so, with those, you've got to make sure that you're giving a consistent message and, the right message. And, when you're talking about working within a team environment, that it's the whole staff that's giving the same message, so that, we're not playing a little bit of he said, she said, kind of mom, dad situation.
Yeah.
But no, I think that my experience so far is that they're appreciative of kind of the effort that goes into that, and just making sure they're informed, whether they, again, retain it or not. It's always appreciated.
And I mean, you have to be on top of your game, of course. And, you keep saying we in regards to just like making decisions for them to return to sport or, anything you do. And how often are you collaborating with other practices for making and managing injuries for the athletes?
So our staff here at NSC, we have the head athletic trainer, we have two assistant athletic trainers, we have myself as the physical therapist, we have a massage therapist, we have an academy athletic trainer, we have our head performance coach. I believe we're in the process of hiring an assistant performance coach. And then I believe we'll have a couple of like fellow like I think a fellow athletic trainer, and then maybe a couple of sports performance interns next year. And so I would say that for kind of going into our third season as a club, we have a pretty robust staff. The way that we have our office set up, I sit in between the head athletic trainer and the head performance coach. I think a lot of times the kind of in this setting, the PT kind of serves the role of bridging medical to performance. And so it's kind of funny the way it worked out that I'm in between the two of them. But every day the medical staff will kind of do a little quick debrief in the morning, just discuss the day and what to expect. And then we'll do the same at the end of the day. Performance is involved in those conversations as well. And then to answer your specific question of, the kind of the return to play process, it's definitely a collaborative effort between the two departments. And then, obviously eventually it gets passed on up to the technical staff where, they're making decisions about, do I think the player is performing in training and ready to get into a match? And ultimately, the call is up to them as to whether or not the player plays. But, we are kind of giving them some guidance on maybe how much play we feel is appropriate.
Overall, was it difficult for you to learn how to communicate between other professions? I know sometimes, PTs are generally really good communicators, but sometimes it's something that we have to work on. And was that the case for you? Did you have to work on communicating between other professions?
I think that coming into this job, I've been very fortunate in some of the other roles that I've had where communication played a big part in it. And so I think I was used to, communicating with other medical professionals, whether it be, physicians, athletic trainers, physician assistants, whatever, same thing on the performance side. But I think that the kind of one added layer to working in this role is kind of the technical staff that we mentioned. And we try to, just so that wires don't get crossed, we try to have the head athletic trainer be the one that relays the messages to the technical staff. So the head coach, assistant coaches, and up from there. But, every now and then I'll get asked questions, and, that's just a case of making sure that we have talked about it and that I'm not, speaking out of turn and saying something different than maybe what the head athletic trainer has said. And so I think there is a little bit of an art to that, and just making sure you don't put your foot in your mouth.
For sure.
And what I would say is that it's one of those things that I've done. I've done it, I've learned from it, and after you've done it, you understand why it's an important skill to have.
Absolutely. And I was going to say, like, what's it like talking with coaches and going to the coach and being like, listen, coach, I don't think he's ready to play. I don't think it's a good time for him to get on the field and to do that.
Yeah. So I think that this is I would say, first experience where like full time, that's potentially something that has to be discussed. Again, I'm not usually part of that conversation, but just kind of being around it. So the reason I say that is because it's kind of like N of one. I think it a lot of times comes down to the coach and kind of their preferred communication method and their style. Our coach is Gary Smith, and I can honestly say Gary has been great to work with. He has been easy to talk to. I think as long as he understands kind of where the player's at and what that means for, kind of their status, that's, really what he wants to know. That being said, I just in talking to colleagues, I know that there are some vastly different, coaching styles or management styles across the league. And, the coaches are a little more, maybe demanding isn't the right word, but a little more involved, and maybe put the pressure on a little bit to get some guys back. But yeah, I think I know I've said this a few times now, but I mean, it's the truth. It really does at this level kind of come down to the individual that you're working with, or individuals.
Individuals, of course. Yeah. And I guess what are ways that you've been successful in rehabbing injuries now that you've been working with professional sports for a little while now and getting athletes back to their game? I guess what are some keys that you found that has made you more successful in appropriately treating and rehabbing athletes?
So I think, I guess as I've developed as a clinician, sort of the way that my mind works, I'll use the term reverse engineering. I have developed, more of an interest in, it's kind of a growing term in the sports world these days, but kind of the performance side of things. So understanding what top performance looks like, and, how is that, illustrated on the field? How is that illustrated with any of the testing that we do? And, really having a grasp of that, and then being able to work backwards off of that. So, for me, it's taking into consideration kind of the normal rehab side of things, but then kind of the, stepping stones, can you tick the boxes to build them back up to that level of performance? And, for me, I think that it helps with communication with the performance coach, who, plays a big role in kind of that last gap from, late stage rehab into kind of getting back out on the field, and then getting back in with the team, with the medical staff as well. And I think that it really goes, a long way in being able to connect better with the athletes, and then the athletes feel like they're being pushed appropriately. And, that it goes back to what we were talking about before, where these guys, it's for most of them, it's not their first time around the block, and they know, they're very in tune with what they need to get back up to speed. And, I think that there's been a learning curve for me in my time here, but, my way of addressing that is communicating with the athletes. Are you getting, what you need? Am I pushing you hard enough? Because if not, I need to know, because you're not going to get better.
Right.
So I think that has probably been kind of the biggest thing, because, yes, we have some more toys, we have some more resources here, but at the end of the day, more or less, a rehab's a rehab. You're going to treat it more or less the same way, whether it's a professional athlete or recreational athlete. And so, I think that skill was there from my career up to this point. It was just, how do you kind of turn it up that last notch?
And are there like maybe tests or maybe indicators or metrics that you use to be like, okay, they're ready for me? Let's just say like lower extremity or like lower extremity injuries. Are there things that you really look out for? Like, okay, they're ready. Like, is it lateral motions? Is it jumping? Is it a combination of like many different things? I guess, what are you looking out for like return to sport?
Yeah, I think it's a lot of different things, and a lot of times it depends on the diagnosis. I think what I'll do is I'll just kind of give you a list of some of the things we've done. We have the Vald suite of technology, so the Force Frame, the Force Dex, the NordBoard. So, you can measure different things on all of those. And so we've found ways to, in some instances, be creative to get, some measurements with those. We you have used something called player makers, which is like a little GPS device that the players will put on their cleat, and it'll measure kicking velocity. It'll measure number of strikes. It'll measure where they strike the ball. And so, for something like erectus femoris, that's been a nice way for us to kind of objectively gauge what we'll call their kicking load, on a day-to-day basis. Our guys were Catapult, the GPS system. And so, with that, again, kind of depending on the injury, I use hamstring as an example. Are they getting up to their max velocity? Are they hitting their top rate of deceleration, their top rate of acceleration? Are they, hitting their normal high speed distances? Those are the things that we start to look at once they get back out on the field. And I think what's, one of the things that's been fun for me is starting to design some in-stage rehab stuff, where you're trying to hit some of that, the GPS numbers, and, seeing if what you plan out on, paper is actually then what happens within the session.
Yeah. And, the reason why I'm spending so much time on this for people who are maybe not in the realm of physical therapy is just like when you get injured, there's kind of the stepwise thing, almost like a progression that we have to build out for you to get from A to B, so to speak. And so it's not always necessarily easy because you have setbacks and you have, quick accelerations, but then you have to stop for a second and you have to change the game plan. And so there's a lot of little nuanced things you have to do in order for you to get from, especially when you're talking about return to sport, because it's not like, for instance, if you roll your ankle normally, you're trying to get back to walking to work or, going up and down stairs. But for these athletes, they have to work at a high capacity. And so bridging the gap from injury to full return to sport, there's a lot of interplay, and there's also a lot of ways to do it. It's not necessarily one track will get you there. So it's, I guess, has your ability to choose exercises to get them back to sport improved over time?
Yes. And I could definitely see where, people who have like coming into like PT school, who have a little bit of like a strength and conditioning background, maybe have a leg up there. But it's actually been one of the hardest things for me to accept as a clinician. But I've kind of learned more and more the value of it the longer I've practiced, and that's the role that experience plays.
Sure.
I think, coming out of school, it's like, I want to know how to do everything. I want to be good at everything. And, you just, at that point, you don't appreciate how much you gain from getting the reps, being exposed to different situations, succeeding, but also failing, and, just kind of getting a feel for, what works when, what works where, how to apply it. And by no means am I an expert. I still have, the way I look at it is I try to learn every day. But, I think that's how you grow, and I think that's how you get better. And that's, I've definitely, I think, improved over time, but certainly still have plenty of room for improvement.
Yeah, likewise. And, I had actually gotten this question from a patient earlier this week, and it was just like, why this exercise and not that exercise? I'm like, it doesn't hurt after when you walk. So that's why I chose you to do that one instead of another one, because the question of like which exercise is certainly, I mean, you can answer it a million different ways, and you can also do it a bunch of different ways. And so it's not always easy to select an exercise, but one, you can go off of gut, and also you can go off from previous experience of just like what was successful and what, made patients better.
Yeah. And I think when you're talking specifically about a sports realm, one thing that I found to have some success with is if you can explain how what that exercise is doing for the individual in front of you ties into sport, even if it's just kind of showing them that it's step one in maybe a 15-step process, but this is how it ties into ultimately what you want to be doing. It goes a long way, and getting their buy-in and kind of helping them to start to connect to the dots of, okay, yeah, that makes sense.
Yeah. And do you use like any like tests to kind of gauge of like which exercises will work or not? One thing that I always like to use is maybe, and especially maybe like in the early stage, let's say once someone rolls an ankle, I have them do exercise. I'm like, okay, now walk. Does it hurt? No. Okay. Or like, does it feel better? Does it feel worse? And I kind of use that as a gauge for some injuries, not always, but I guess, are you using something, or are there ways for you to kind of guess about like, okay, this is appropriate exercise, it isn't?
Yeah, I think I think to put it simply, a lot of times it's how does that feel? Have them do it. If it goes great, then great. Let's do a little more of that. If it's too easy, then all right, let's make it harder. If it doesn't go well, then scrap that. We'll modify it this way. Um, I think that that's another thing that I've learned over the years is it's each exercise, and I won't necessarily say this for all of them, but like in a way, it's an assessment in and of itself. You do your assessment to try to figure out kind of where to start, but you've got to have plan A, plan B, plan C, and just be adaptable. Because again, we keep saying it, but these are all individuals, and it's never going to be the same pathway, from one to the other. Um, Something that same diagnosis worked for one person may not work for the other person. So, yeah, I think that's definitely, for me, just a very simple, um, kind of like with you, you mentioned walking. Like, yeah, I think I probably have in general some like stepping stones that you tend to go to more than often, but more often than not, I should say. But it's really just kind of comes down to, if you feel like you're getting the right stimulus from it, you go with it. If it looks way too easy, then maybe they only do a set and then you make it harder. If it's way too hard, then maybe you regress a little bit. But that's, as rehab professionals, that's really the way it should be. It shouldn't be a one size fits all. It should be you find what works for the person in front of you.
And I think that's what I love about PT, right? Where you have to problem solve, because in like medicine, when you're going into a surgery, or perhaps even someone who's got diabetes, or someone has coronary artery disease, there's a specific kind of like medicine protocol. There's like individual steps or things that you need to follow. And it's like, oh, okay, this is this person. I can put them in this category and I can check off the boxes. But with rehab, especially when it comes to return to sport, there aren't any boxes to check. It's more of us kind of getting a little creative and trying to figure out alongside with the patient and being like, does this work? No. Okay. Does this work? This is what we have to do. Okay. Let's run with that one instead.
Yes, that's part of the fun of it. Is it everyone's a puzzle.
Mhm.
Every patient is a new puzzle, and you've got to figure out how to put it all together.
Did you have to kind of, you mentioned that it would be helpful to have a background in strength and conditioning. Did you have that background in strength and conditioning, and did that really help you with exercise selection?
I would say I had an interest. I wouldn't necessarily say I had a background. I think one thing that helped me is I had some experience working as an aide going into PT school, and it was in more of like an outpatient sportsy type setting. And so I had a little bit of a leg up just on, all the different kind of exercise variations I had seen up to that point. But then I think that, my kind of interest in more of the S&C performance side has kind of grown as I've seen, how that potentially ties into what I do on a day-to-day basis. And that's an area I'm still trying to kind of grow and better understand and get better in.
Yeah, certainly. And I guess, what other continuing education pieces do you think are of value for perhaps even up and coming sports physical therapists, or even current sports PTs?
Yeah, so I think that the I'm noticing this with a lot of students, a lot of I don't come across but so many, but a lot of resumes I've seen. The CSCS designation, I think, has become more prevalent. Uh, you know, I actually don't have mine. I When I was at Virginia Commonwealth University, I got the book. I had read it. I was ready to take it, and then an opportunity at Duke presented itself. Got swept up in that. this past year, I bought the study guide for the SCS. Right after I bought it, this opportunity presented itself.
Yeah.
So it's on my to-do list. I've gone through the material. I think it's great. The NSCA actually has a new certification. Hopefully I say the letters in the right order, but it's I believe CPSS, the Certified Performance and Sports Scientist certification. And I bought the textbook for that. And I think I've made it about halfway through it, but it's been awesome. I've taken a lot from it. And sports science is really big right now, and it's a growing field, and honestly, it's fascinating. It's science. So, we're learning as we go. But to, kind of start to think about the way that some of that ties into, what I do as a rehab professional has been very, we'll call it invigorating for me. It's a new challenge. And I think again, just the more of the picture that you understand, the better able you are to put all the pieces together and arrive at that outcome that you want at the end of the day.
It is funny how many, I mean, one, it's always funny to see how many letters we have after our name in regards to just like certain performance stuff. But I guess like everyone's kind of got their own twist, and you're just taking little pieces here and you're like, oh, that was important then, let me use it now. Or this one was important. Oh, I remember this in PT school. Let me try this out. And it's kind of like we're bringing this all together to this soup, but there's not really a gold standard in regards to just a treatment approach to return to sport or return to play or even rehab an outpatient to begin with.
Yeah, I think that the people that you see who have been in the profession for a long time are the ones that are, the best at putting it all together and, being creative, thinking outside the box a little bit, understanding that it's not a one size fits all approach. And, again, I'm going to sound like a grumpy old man, but just, the longer you do it, the more that I've come to appreciate that.
Absolutely. And I guess overall within the realm of professional sports, now that you've been with Nashville and as well as working with the men's national team, are there things within the sports realm of sports rehab that need to change?
I think that what's great is about just medicine in general is that it's always progressing. We're always learning more. So, very simple answer. Yes, I think we continue to, do the research and figure out, the answers to some of the questions that we all have as clinicians. I think that, I know that's a very broad answer, but I think that, in this case, that is very applicable to what we do. And then I think that, I had one more little side thought off of that, but maybe I'll leave it broad at that. It's just that, we all need to continue to, I remember my side thought, we all need to continue to challenge ourselves. And when we talk about the research, I think one prevailing theme that I've noticed through, most risk factor studies is that usually the number one risk factor for injury is prior history of injury. And, maybe I'm right, maybe I'm wrong, but that just kind of leads me to question, are we rehabbing well? If that's always the number one risk factor, then did we not fully fix it in the first place? And so, maybe that's not the right question to ask, but it's certainly something that, drives me a little bit, motivates me. And, I approach every rehab as trying to, do everything that we can to feel like we've done all that we can for that individual. And if it goes well, then great. If not, then we learn from it, figure out what could have been better and do better next time.
Well, it's certainly an interesting question, one that I've thought of myself, because I've seen, I've had patients who have gotten re-injured, and I've also seen patients who seen therapists and also have been re-injured, and they're seeing me instead. And so it's like, are we missing something? It's not necessarily that the patient didn't get better and they didn't get back to sport. It's just like, should we have waited a little bit longer to get them stronger? Or was there something more that we could have done education wise? Was there another exercise or something that I think which we need to continue asking ourselves of like, are we doing a good enough job to continue getting people to what they want to do?
Absolutely. And I think, we always talk about evidence-based practice, and, I think we should all, I think in school I got tired of hearing it, but we really should all be doing our best to try to live that and support it and grow it and learn more about our profession. And, at the end of the day, it's going to be what makes us all, more successful and, really continue to grow as a profession.
Have you been taking steps to perhaps analyze data to help maybe lead to better decision making? You started talking about various tools and things that you guys use for perhaps like rectus femoris or like velocity and things like that. I guess, are there new tools that you guys are utilizing to help drive evidence-based decisions?
We're getting there. I think that, we have collected a lot over the course of the season. I think that some of it we've been able to kind of skim the surface, some of it we've been able to dive into, but as we continue to grow as a club, there are clubs that have full-time sports scientists that have more than, one sports scientist. They have, data experts. I think that, maybe potentially that's, in the future for us, and, they help us dive into that a little bit deeper. I can tell you that in my time here, I've definitely gained more of an appreciation for all of the statistical stuff that they make you learn in school, and that you continue to see come up in the literature. It having an understanding of what all that is has really been illustrated for me, and is another area that I'm definitely brushing up on and improving upon. But yeah, I think that just the sheer volume of this type of setting and what you actually can collect. They use this expression for raising a kid, but like it takes a village. It's a team effort to understand it all and dive into it all and decipher it all. And, even just having a program that can present it all legibly to you to make some sort of sense is actually important. So, we use Kitman, which is our athlete management system, and it will aggregate a lot of the different values that we measure on a daily basis, and will help us find means and maxes and minimums and standard deviations, Z-scores, things like that. But I know that there are also teams who have like hired a whole data department to build their own athlete management system from the ground up, so that they're making sure that they get exactly what they want out of it. So that's a very interesting side of the field that I think is continuing to grow, and I think that our profession is going to get swept up into that a little bit, with a lot of the wearable technologies and things like that. And we've mentioned GPS in this talk, and yet yes, it's great. It's an expensive resource that we have at this level, but as the technology becomes more common, you're going to have an everyday, PT in the clinic, just the average outpatient clinic, it's going to be able to give a patient a little device to put in their shoe or wear on their back and go out for a walk. And then you'll have an app and be able to look at, oh, look, they've got a, gait asymmetry on, that leg that's been bothering them. And so it's coming. And I think that, we all just need to be prepared to kind of go down that route.
I'm excited for that, and certainly more information is always better. But again, do you think it has to change at a PT school level, where you have to learn during PT school all the things of how to analyze data, or perhaps take it all in, or is it more of just something you have to do outside, similar to that of maybe like a residency or a CSCS and so forth?
I think for now, with where we are, it's more a skill that you develop being in the field. I think that as it becomes more prevalent, I think it becomes more of a case of curriculums change to reflect that. And, when it becomes common, like everyday practice, then I think that you will see that, incorporated into a lot of the PT school curriculums.
Hopefully, and hopefully we can continue to be more specialized. And I feel like the more specialized we get after PT school, the more we can help patients in a better manner, because being a generalist can be okay, but sometimes it doesn't necessarily lead to better outcomes if you're just kind of like dabbling in many different areas.
Yeah. And, I will say this, it can be a double-edged sword, because you can have so much that, how do you determine what's meaningful? So it's great to have it, but at the same time, like, we've also got to be able to, cut through some of the maybe extraneous stuff to really get down to what actually does matter.
And do you feel the field of sports PT is growing? Do you feel like there's more and more sports PTs, and are you collaborating with more of them? You had mentioned you've gone overseas and worked with some physios over there as well. And do you feel like the field continues to grow?
It does. I think that you are, starting to see a lot more PTs in the sports realm. I don't want to misspeak, but I am pretty sure that I think the NFL mandates there be a PT on staff, or maybe it's not the NFL, maybe it's Players Association. I don't know, but I'm pretty sure that every NFL team has at least one PT on staff. I think a lot of NBA teams have two on staff. I think you see most Major League Baseball clubs having at least one, and then having a few maybe affiliated with their minor league associations. Speaking specifically about the league I'm in, MLS is currently at 27 teams, and I don't want to, that there are a couple of PTs who are also athletic trainers that are in the head athletic trainer role. But if you're talking specifically about like PTs that are directly employed by the club working in a PT role, there are 11 of us. And that actually, I want to say this season, there were at least, I don't want to get this wrong, there were at least two of us added this past season, if not more than that. And so, we're still not quite at 50% of teams in the league that, directly employ a PT. And that's not to say, that those other teams don't work with a PT. It just may be, through their medical affiliation or whatnot. But that number, has kind of grown every year recently. And so, specifically within Major League Soccer, I think you're starting to see some value placed on having a PT on staff. And I'm very fortunate in that our head athletic trainer had worked with Sporting Kansas City for a long time, and they are one of the original MLS clubs. And, they've got a great organization from top to bottom, and they're run very well. And, he was always used to working with a PT. And so when he came here and started to build out his medical staff for Nashville, PT was on his wish list. And I think it's, again, I think it's great that for their second season, they employed a PT, and I was fortunate enough to kind of find my way into that role. And I look forward to continuing to see, there be more opportunities with other teams in the league.
It's certainly exciting, and that's also great for you, of course, to get in there and lead the team to hopefully continue more wins and more, maybe even a championship if lucky enough.
Fingers crossed. There's a lot that would have to happen, but never say never.
Never say never. And one other thing that I was kind of thinking about is just how, there's this interesting conversation with physical therapists, just in the general sense, not replacing, but being an outpost for primary care. And I guess, do you see that perhaps sports PT could be an outpost, or at least maybe a substitute for like an orthopedic physician being there during game time? Or do you think both roles play an important and crucial role?
Ooh, this is a tricky one. I think that both have a place. I think that this is somewhat similar to, kind of the hot button topic of actually like sports PTs becoming a thing. I'm very fortunate, and every athletic trainer I've ever worked with, I've got along with great. I know historically there's, maybe been a little friction there between ATs and PTs in some settings. But I think that like with that, there's a place for both, and they play a key role in a well-oiled system. And I think say similar about, a sports PT versus a primary care. I think there's a role for both. I think that different states allow different things. I think direct access that a lot of states do have for PTs is great for the right situation. Earlier in the conversation, I mentioned like a soft tissue, like muscle strain. This isn't the case everywhere, but there are certainly instances where it's not easy to get in to see a doctor. And if you're having to wait 6 weeks to get in to see a physician for a muscle strain, and then you have to wait, let's say 2 weeks to get in to see a PT,
it's been a long time.
Yeah.
Yeah.
That's 2 months of doing nothing. So, I think that there's a place for both. And I think the opposite side of that is, let's say that, there's an injury that, maybe PT doesn't feel but so significant, and, they haven't done anything wrong. They've done their assessment. They've done everything by the book, but maybe there's something underlying that they're just not going to be able to assess. And that winds up being problematic. Well, maybe that was a case where, that primary care physician could have caught it in the first place. And so, I've kind of danced around a little bit, but I do think at the end of the day, there's a need for both.
I would agree. And I think, as PTs continue to grow and learn more, especially in the management of like acute injuries, where it's like managing, cervical neck injuries or contusions or, emergency medical situations, they're starting to become a lot of overlap. And so it'll be interesting to see how it all plays out in regards to both the sports and orthopedic realms kind of start rubbing together in that sense, not in the medication realm, but maybe in the sense of just acute management of injuries.
Mm-hmm.
And for you, I guess we've been talking about the future of sports PT. For you, what's next career-wise? Is it just continue to building that career and working towards the championship with Nashville? I guess, what would you say the next steps are?
Yeah, we talked a little bit about it before earlier. And if you had asked me in school if this is what I'd wind up doing, I would have said no. I honestly don't know that I've had like a set career goal. It's just kind of been, over the course of each job, like I felt like I was growing. And then when I felt like I wanted to grow in a new direction, I, started to look elsewhere. What I will say is I have loved my first year here. I think that it was the direction I was headed, and that this was where I needed to be to kind of cultivate some of those skills that I wanted to grow with. And one of the things that really excited me about coming here was the fact that it was an organization that was just entering its second year. And being the first kind of PT in the door and having an opportunity to grow with the organization and figure it out with, we've got a new stadium next year, we've got a new training facility down the road. Our academy just started up this year. Just everything is so fresh and so new. I think that, for me personally, I'm really excited about what that challenge presents, but also, how it allows me to grow as a clinician within that setting.
And certainly it's like you guys are kind of out in open sea or above the clouds, and you kind of got nowhere else to go but up. So it's kind of exciting, and I'm happy for you that you got this opportunity to continue building with a brand new team and hopefully just continue to see success along the way.
Yes, we've been a little bit spoiled this year, and I would say me specifically, and just that it's been a good season, and not everyone has a great season, and I could see where that would, maybe make for not as fun of a year if that were the case. But embrace it, enjoy it, and just take it one day at a time.
Absolutely. Well, listen, we're kind of wrapping things up here at the end there. I really appreciate you coming on to answer all my questions and provide so much valuable information. And we're going to be closing out with a couple final questions, which you've had time to look at. And this is the portion called Health Me to Health You. And so the first question is, if you had the attention of everyone in the world for 30 seconds, what would you say?
Yeah, this one was definitely one I had to think about. But I what I came down to was I think that what I would say is in the world as we know it today, uh, everything is starting to become more and more polarized, and it's almost like a line is drawn in the sand, and that's you see it on social media, you see it in politics, you see it in a lot of different ways, and I would just ask everyone to stop and remember at the end of the day we are all on team human, and you know let's have compassion for one another, and find a way to coexist and make the world a better place.
I think that was just under 30 seconds. So that's, I think that's the best one so far. So I think you practice well. Second question. What book do you recommend, whether a current read or in the past?
So two parts here. One, I will say the NSCA CPSS book that I mentioned earlier, I've really enjoyed, and I think that it's just been published within the last year. So if anyone has an interest in sports science and kind of tying that to PT, definitely look into it. And then I don't necessarily have a specific title, but I will go ahead and let my geek flag fly. I'm a big science fiction fan, so I'm currently working my way through Isaac Asimov's Foundation series, and I've enjoyed that. So anything science fiction.
Sweet, good. Well, I think that's the first nonfiction book, so it's good. It's good to hear a little bit of alternative to that. The last question: where can people find you? Maybe on social media, or perhaps other places that they can learn from you.
Yeah, a little bit of my Achilles heel here. So I have LinkedIn. You can always reach me on there. I have Twitter. And I would say that the primary reason I have Twitter is for professional reasons, try to stay current with research and follow some other like-minded individuals, or not like-minded individuals to get a different perspective. But I would say those would be the two main avenues. I don't have Instagram, so don't look for me on there. I don't even know how to work TikTok, so definitely don't look for me on there, but Twitter or LinkedIn.
Michael, thank you so much for coming on the podcast. I really appreciate it.
Yeah, Michael, thanks for having me, and really appreciate it. And again, hopefully was able to provide some good insight. I've had some great mentors along the way that have helped me get to where I am today. And hopefully I maybe said something over the course of this that sparks someone, and they become the next great sports PT.
Certainly motivating for myself, so I really appreciate it. I'm sure a lot of people will also benefit from this as well, for other physical therapists or even people who aren't physical therapists but curious about the profession of sports PT and rehab. Certainly would be helpful to listen. So thanks again.
Yeah, absolutely. Thank you.